To report today, as the President mentioned, on our legislative team on Capitol Hill. We're working with Republicans and Democrats at this very hour to pass an economic recovery package that the President described, and we hope to see the Congress act on that early next week. On the subject of supplies, we continue to make steady progress on testing. Thanks to the President's involvement of commercial labs, the public and private partnership, more and more Americans are being tested every single day. And tomorrow, Admiral Gua and FEMA will update the American public on the status of testing and our support of state-based testing efforts that are literally expanding by the hour. On the subject of medical supplies, we continue at the President's direction to pursue every means to expand the supply of personal protective equipment for the extraordinary and courageous healthcare workers that are ministering to the needs of people impacted by the coronavirus. We have a policy of procuring, allocating, as well as conserving the resources that we have in our system. And now that the President worked with the make industrial masks fully available for hospitals to be able to purchase, to be able to use as protective equipment, we're more encouraged than ever about the availability of those important N95 masks to our healthcare facilities. And over this weekend, we'll be announcing a major procurement from the federal government, N95 masks as well. We're also encouraged that we're finding new alternatives to increase the supply of ventilators. We've mentioned that we have a federal stockpile, some 20,000 ventilators on standby, but that doesn't count the tens of thousands of ventilators that are in our healthcare system around the country. But the President has challenged us to work to free up other ventilators from other sources around the country, and there are two different ways that we're doing that. Number one, in our recent discussion with anesthesiologists, we've literally identified tens of thousands of existing ventilators that can be retrofitted and converted to be ventilators for people struggling with the coronavirus. But also, on the President's behalf and behalf of all of our task force, we want to continue to urge every American and every American hospital and healthcare facility to postpone any elective medical procedures. This will free up bed space, free up hospital capacity for people that are struggling with the coronavirus, and it'll also free equipment that our healthcare 15 days to slow the spread. And as the President said at the outset of his remarks, I know that millions of Americans are doing that just now, and the greatness of the American character is shining forth.
Thank you, Mike. Thank you very much. Okay. Thank you. Go ahead.
You had a call with Senator Schumer. He says you've now agreed to invoke the Defense Production Act to actually make those medical supplies that hospitals say are in severe shortage. So two questions. Is that what you're doing now?
It is. I did it yesterday. We invoked it, I think, the day before. We signed it the evening of the day before and invoked it yesterday. We have a lot of people working very hard to do ventilators and various other things.
So
yes.
you're using it now to tell businesses that you make ventilators, masks, respirators?
Yeah, for certain things that we need, okay. including some of the very important emergency. I would say ventilators, probably more masks to a large extent. We have millions of masks which are coming and which will be distributed to the states. The states are having a hard time getting them, so we're using the Act. The Act is very good for things like this. We have millions of masks that we've ordered. They will be here soon. We're having them shipped directly to states.
So you said you were signing this but not invoking it. This is what you said yesterday, and that you would only do so in a worst-case scenario. So are we now in a worst-case scenario?
We need, no, it's no different other than we need certain equipment that the states are unable to get by themselves. So we're invoking it to use the powers of the federal government to help the states get things that they need, like the masks, like the ventilators. Yes, Steve?
Governor Cuomo has done in New York, is there any more consideration to a national lockdown to keep people in their homes?
I don't think so. Essentially, you've done that in California, you've done that in New York. Those are really two hotbeds. Those are probably the two hottest of them all in terms of hotspots. I don't think so, because you go out to the Midwest, you go out to other locations, and they're watching it on television, but they don't have the same problems. They don't have, by any means, the same problem. New York, California, Miami, the governor's doing an excellent job. Governor DeSantis. In Florida, we have some pretty hot spots in Florida too. But we're general in the state of Washington, of course. But that was largely, if you look at it, it was one nursing home that had problems like you wouldn't believe. So no, we're working with the governors, and I don't think we'll ever find that necessary.
About a week into your 15-day guidelines, are you happy with the progress? Would you like to see?
I am happy. I am happy with it. We'll have to see what the results are at the end of 14 days. Let's say we'll know by the 15th day to see what we do. But I'm certainly honored by the way the American people are working, because it's work. It's work not to work. This is the first time this has ever happened. And we're working out a tremendous financial package for them so they don't work. Usually you work out a financial package to get people working. We're asking people not to work. Social distancing, a new term that's become probably the hottest term there is. So, no, I'm very honored by the way the American people are taking this, I mean, so seriously. Yes, John?
Mr. President, a question for you and a question for Dr. Fauci, if I could. There's been some concern among Democrats on Capitol Hill that the Phase 3 fiscal stimulus is weighted too much in favor of corporations and not enough in terms of individuals. What did your conversations with Senator Schumer yield on that front?
Well, I think that really all of that is being discussed right now. We talked about, as an example, buyback stock. Keep the company going, but not for buybacks. I haven't spoken to a lot of the Republicans or Democrats on it. We discussed it, and I don't like buybacks. I didn't like them the first time.
Are you and Senator Schumer?
So we're discussing. We're discussing that. We're discussing many things.
On the same page from Senator Schumer?
We're not so far away. We're not very far away.
To Dr. Fauci, if I could. Dr. Fauci, this was explained yesterday that there has been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID?
The answer is no, and the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that would give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in the controlled clinical trial, so you really can't make any definitive statement about it.
Mr. President, on
I think without seeing too much, I'd probably be more fan of that than anybody. But I'm a big fan of it. See what happens, and we all understand what the doctor said is 100% correct. It's early, but I've seen things that are impressive, and we'll see. We're going to know soon. We're going to know soon, including safety. But when you get that safety, this has been prescribed for many years for people to combat malaria, which was a big problem, and it's very effective. It's a strong drug. So it's
Effective against SARS.
It was, as I understand that, is that a correct statement? It was fairly effective on SARS.
John, you've got to be careful when you say fairly effective. It was never done in the clinical trial. They compared it to anything. It was given to individuals and felt that maybe it worked. So you
compare it to.
well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care plus the agent you're evaluating. That's the reason why we showed back in Ebola why particular interventions worked.
Sir, on that topic. About the possible therapies, yesterday, Mr. President, you said that they were for, quote, immediate delivery, immediate. We heard
we were ordering, yes, we have millions of units ordered. Bayer is one of the companies, as you know, big company, very big, very great company. Millions of units are ordered, and we're going to see what happens. We're going to be talking to governors about it, and the FDA is working on it right now. The advantage is that it has been prescribed for a totally different problem, but it has been prescribed for many years, and everybody knows the levels of the negatives and the positives. But I will say that I am a man that comes from a very positive school when it comes to, in particular, one of these drugs, and we'll see how it works out, Peter. I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. But we have ordered millions of units. It's being ordered from Bayer, and there is another couple of companies also that do it.
Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree. I guess on this issue,
I think we only disagree a little bit.
Sorry.
I disagree. Maybe or maybe not. Maybe there is, maybe there isn't. We have to see. We're going to know.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Representing preparedness right now.
No, I don't think so. I think that I think it's got
the not yet approved drug.
Such a lovely question. Look, it may work and it may not work. And I agree with the doctor when he said, may work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it. And we're going to see. You're going to see soon enough. And we have certainly some very big samples of people. If you look at the people, there are a lot of people that are in big trouble. And this is not a drug that obviously, I think I can speak from a lot of experience because it's been out there for over 20 years. So it's not a drug that you have a huge amount of danger with. It's not like a brand new drug that's been just created that may have an unbelievable monumental effect, like kill you. We're going to know very soon. And I can tell you, the FDA is working very hard to get it out. Right now, in terms of malaria, if you want it, you can have a prescription. You get a prescription. And by the way, and it's very effective. It works. I have a feeling you may, and I'm not being overly optimistic or pessimistic. I sure as hell think we ought to give it a try. I mean, there's been some interesting things happened and some good, very good things. Let's see what happens. We have nothing to lose. You know the expression? What the hell do you have to lose? Okay?
So what do you say to units are nearly 200? John, go ahead. Dead. What do you say the Americans were scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say.
I
think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism, and the same with NBC and Comcast. I don't call it Comcast. I call it Concast. Let me just for whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.
Let me get back to the science of it.
It's going to be a shame of yourself.
The units that were ordered, are they for clinical trials or are they for distribution to the general patient population?
We are going to, as I understand it, we are going to be taking samples in New York. Governor Cuomo very much is interested in. That's right. And they are going to work.
Available for people who might want the hope that it might work. You're also collecting data that will ultimately show that it is truly effective and safe under the conditions. repercussions of COVID-19. So there really isn't a difference. But it's just a question of how one feels about it. Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the toxicities are rare, and they are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe. But I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
I agree.
Sir, your message to Americans who are working at home, who have their children in their homes right now, who are homeschooling, doctors who say they don't have the masks they need to do their jobs, your message to them.
My message to the American people is that there is a very low incidence of death. You understand that. And we're going to come through this stronger than ever before. If you get it, if you happen to get it, it is highly unlikely. It's getting to a number that's much smaller than people originally thought in terms of the ultimate problem, which would be death. My message to the American people is, number one, you've done an incredible job. Incredible what you've gone through. It's been incredible. It wasn't their fault. It wasn't their fault. It wasn't the fault of 140 other countries where this has happened. And there is tremendous hope. And I think we're going to come out stronger, better, bigger in every way. I think we're going to be a better than we were before. And we learned a lot. We learned on reliance, who to rely on, who not to rely on. But our country has been incredible, the way they pulled together, including the fact that I just spoke to Senator Schumer. We had a wonderful conversation. We both want to get to a good solution. But it's been really, for me, watching and seeing people that weren't speaking, getting along well, because we all have one common aim, and that's to get rid of this invisible enemy, get rid of it fast, and then go back to the kind of economy that we had, and maybe even better. Yeah, please, in the back. No, in the back, please.
Mr. President, I have two questions to indulge me. The first question is, many small businesses are concerned that they have weeks, not months, and are worried about how long it'll take them.
We're going to be helping them a lot. We're going to be focused, a big focus, and including my conversation with both Mitch and with Chuck, a big focus of that conversation with small businesses, because they are really the engine behind our country, more so than the big ones. They are the engine behind our country.
Second, if I may, sir, are you concerned about members of Congress that may have used information they learned on updates to sell stocks and profit off of this?
I'm not aware of it. I saw some names. I know all of them. I know everyone mentioned Dianne Feinstein, I guess, and a couple of others. I don't know too much about what it's about, but I find them to all be very honorable people. That's all I know. And they said they did nothing wrong. I find them, the whole group, very honorable people. Yeah, please.
Mr. President, so the whole group would include Richard Burr, the head of the Intelligence Committee, and it also would include Senator Kelly Loeffler. And so the question is whether or not they should be investigated for that behavior.
Well, it also includes Dianne Feinstein, a Democrat. You didn't mention her name. Why didn't you mention her name? And I think she's a very honorable person, by the way. So I'm not saying, but, you know, it's interesting that you mentioned two people, but you don't mention one that happens to be a Democrat.
Any senator, should they be
I don't know, because I'd have to look at it, possibly, but I find them to be honorable people. Yeah.
You said the other day you can hear yourself, you see yourself as a wartime president right now, leading the country through this pandemic that we're experiencing. Do you really think, you know, going off on Peter, going off on a network is appropriate when the country is going through something like this?
I do, because I think Peter is, you know, I've dealt with Peter for a long time. And I think Peter is not a good journalist when it comes to fairness.
But he's asking for your message to the country.
Oh, I think it's a good message, because I think that the country has to understand that there isn't indeed, whether we like it or not, and some of the people in this room won't like it. There's a lot of really great news and great journalism, and there's a lot of fake news out there. And I hear it all, and I see it all, and I understand it all, because I'm in the midst of it. So when somebody writes a story or does a story on television, and I know it's false, I know it's fake, and when they say they have 15 sources have said, and I know that there's no sources. There's no sources. They're just making it up. I know that, and I call Peter out, but I call other people out too. And this is time to come together. But coming together is much harder when we have dishonest journalists. It's a very important profession that you're in. It's a profession that I think is incredible. I cherish it. But when people are dishonest, they truly do hurt our country. Yeah, in the back. Please go ahead.
Mr. President, China has been in communication with the United States and also WHO about coronavirus.
Right.
And the U.S. shut its border. Travelers from China on February the 2nd. Also, Wuhan has been in lockdown since January the 24th. And this all happened almost 2 months ago. Why did you still say if you could have known it earlier? And also, you have been calling coronavirus.
Well, I have to say this. We have, and I can speak for myself, but I have a very good relationship with China and with President Xi. I have great respect for President Xi. I consider him to be a friend of mine. It's unfortunate that this guy
has not announced any travel ban on Europe. Where have you been in touch with them as to when they're going to do this and what it is that they're telling you? And then a second question, they also are telling us and said in a press conference this morning that they will not take back any non-Mexican citizen. Any other third parties will have to, we don't know what will happen to them. So can you address what will happen to those third country immigrants that you are saying that will not be allowed to enter the U.S. and Mexico is saying that they will not be allowed to stay in Mexico either or sent back from the U.S.?
I'll take the first one and then Chad, I'll give you the second one. With respect to travel into Mexico from outside, I spoke with Foreign Minister Ebrard a couple of times about this. I'm very confident we're going to get to a really good place that protects the Mexican people and the American people from those who might be traveling into places where we've got designations, the Schengen zone from China, so that they're not coming into Mexico and then coming into the United States. I'm very confident we'll do that. We'll make that announcement shortly together.
Again, as we implement the CDC's order, again, we're going to take a number of individuals that cross the border illegally and repatriate them or remove them quickly back to Mexico, back to the Northern Triangle, and back to any other country. So we're going to do that in a rapid fashion. We'll continue to work with Mexico to make sure that Mexican nationals go back as well as other populations.
Sending Guatemalans back to Guatemala or Cubans back to Cuba, what would you do with those third countries that are not Mexicans?
So we're doing all of the above. We're going to be sending, again, individuals back to Mexico, individuals back to Northern Triangle countries, Cuba, Haiti, all of the, again, 122 different nations that we see nationalities that come across that border. We'll be sending them individually to their countries, but also with working with Mexico to send additional populations back there as well.
And just to put it, when you said before, you said the non-Mexicans going to Mexico. We're not sending them to Mexico. We're sending them back to their own countries, not to Mexico. Why would Mexico take people that aren't from Mexico? We're sending them back. In the case of Guatemala, Honduras, El Salvador, a lot of other countries, they go back to the country from where they came. Okay, and Mike, please.
Secretary Pompeo, on the issue of disinformation, is there any particular locus for this disinformation, or is it diffused?
It's pretty diffused, unfortunately, but we've certainly seen it come from places like China and Russia and Iran, where there are coordinated efforts to disparage what America is doing in an activity to do all the things that President Trump has set in motion here.
Other than what you're doing this morning, what are you doing to fight back?
Lots of things, lots of work. One of the things we want to make sure is the American people go to trusted sources for that information. But we've made clear, we've spoken to these countries directly that that they need to knock it off, that we don't approve of it. And then there are a handful of other things we're engaged in to make sure that the right information is out there and accurate information is given. This idea of transparency and accurate information is very important. It's how we protect American people from something like this ever happening again.
Mr. Secretary, Peace Corps volunteer.
want the American people to be coming to trusted sources of information. Does it undermine you at all when the president stands up here and he attacks news outlets calling us untrustworthy?
Somebody else have a question?
The Peace Corps volunteers have the Peace Corps volunteers.
Please.
Americans who find themselves stranded in places where there are no longer flights to get back to the United States, what efforts are being made to help them?
I appreciate that question. So we're doing lots of things. We've had a couple places in particular, Peru and Morocco. I think we've had the first 2, maybe 3 now flights out of Morocco. We're going to work to get people back. We're urging individuals when they can't get back on their own, they traveled there on their own. When they can get back there on their own, they ought to try to do that. But we have a team stood up at the State Department, the Repatriation Task Force, that is working each of these instances. So we've heard from individuals, members of Congress. We're trying to get Americans back from these places where air travel has been disrupted. And we'll get that done over time. We'll get it done successfully.
Do you have any sense of how big that problem is?
How long
Is there any sense of just how big that problem is? How many people?
We don't know the full scale of it yet, but we think the largest number identified, and we're working. If there are those who are watching that are someplace, and you can go on the State Department website, you can log into step.gov.
Relaxing sanctions on Iran during the coronavirus crisis is to be particularly hard hit.
That's an important question. The whole world should know that humanitarian assistance into Iran is wide open. It's not sanctioned. We've offered to provide assistance to the Iranians as well. I talked with Dr. Tedros from the World Health Organization about this. We're doing everything we can to facilitate both the humanitarian assistance moving in and to make sure that financial transactions connected to that can take place as well. There is no sanction on medicines going to Iran. There's no sanctions on humanitarian assistance going into that country. They've got a terrible problem there, and we want that humanitarian medical healthcare assistance to get to the people of Iran.
Sanctions themselves, no movement.
We are working to do all the things we've had in place for the first 3 years here to deliver security for the American people.
They know the answer. Iran. They know the answer. Iran. The leaders. They know to your question.
Wasn't it appropriate for the president to call your department the deep state department at a time when governments are working very hard around the world to combat this pandemic?
I've worked with the president for 3 years now. I know how much he values the people that work on my team. I know when I was the director of the Central Intelligence Agency how much he valued the work we did. I know that he watches our team, Dr. Birx, all of the team that's working to push back against this virus, to keep America safe. I know how much he values them.
What a good answer. Excuse me, we'll do it in a second. Mike, yes.
May I just say one more thing? There's been some discussion about China and what they knew and when they knew it. And I've been very critical. We need to know immediately. The world is entitled to know. The Chinese government was the first to know of this risk to the world. And that puts a special obligation to make sure that data gets to our scientists, our professionals. This is not about retribution. This matters going forward. We're in a live exercise here. Get this right. We need to make sure that even today, the data sets that are available to every country, including data sets that are available to the Chinese Communist Party, are made available to the whole world. It's an imperative to keep people safe. We talk about the absence of data sets, not being able to make judgments about what to do. This is absolutely critical. This transparency, this real-time information sharing isn't about political games or retribution. It's about keeping people safe. And so when you see a delay in information flowing from the Chinese Communist Party to the technical people who we wanted to get into China immediately to assist in this, every moment of delay connected to being able to identify this the risk vectors, creates risk to the people all around the world. And so this is why it's not about blaming someone for this. This is about moving forward to make sure that we continue to have the information we need to do our jobs.
Mr. Secretary, what message do you think it sends to other countries when you have the President of the United States lashing out at reporters?
I've had my frustration with reporters too. All I ask when I talk to the media is that you listen to what we say and report it accurately. And it's frustrating. It's frustrating when you see that doesn't happen. It's enormous. We have a responsibility to tell the American people the truth, and those who are reporting on what it is we're doing and saying have an equal responsibility to report it.
What message does it send to countries when you're flashing out reporters?
I've seen many things at the State Department be reported wildly and accurately on multiple occasions, and I have spoken to those reporters about it each and every time, and I will continue to do so.
Mr. President, Senator Johnson has suggested...
Well, I'd rather have, if you could finish up with the Secretary.
I think I've worn him out, Mr. President.
Is everybody finished, Secretary of
Let me ask
State?
you both, if that's all right. Mr. Secretary, Senator Johnson has suggested that you and the administration may be overreacting. He said, we don't shut down our economy because tens of thousands of people die on the highways. We don't shut down our economies because tens of thousands of people die from the common flu. At worst, 3.4% of Americans will die from this virus, he said. What do you say to people that have that view? That's 11 million people he's talking about.
Well, I can just say the entire world is agreeing with us because they all have their choice, and everybody's doing the exact same thing. We want to shut it out, and we can do that. And we'll see what happens in 2 weeks and 3 weeks. But if we can save thousands of lives, and even millions of lives potentially, you don't know where it goes, but you could be talking about millions of lives. So if you look at the world, I mean, you have some very smart people in the world, you have some smart leaders in the world, and everybody's doing it the way we're doing it. I think we're doing a better job than hopefully most, if not all. We're doing a very effective job, but we'll know better in 14 or 15 days. But, you know, you're talking about hundreds of thousands, and maybe more than that, numbers of people. And, you know, we can bring our finances back very quickly. We can't bring the people back.
Mr. President, to follow up on that, there are millions of people out there that share that view, that say, I don't really need to shut things down. I don't really need to stay away from stores. I can go to the beach. And those people making multiple actions exponentially, it's the difference between life and death.
Yeah, I agree with that. But I think I'd like to have Anthony answer that, because to be honest, that's what he does. And we had a lot of very talented people telling us what they think we should do.
Thank you, Mr. President. First of all, I think that's a false equivalency to compare traffic accidents with. I mean, that's totally way out. That's really a false equivalency. When you have something that is new and it's emerging, and you really can't predict totally the impact it's going to have, and you take a look at what's going on in China, and you see what's going on right now in Italy, and what's happening in New York City, I don't think with any moral conscience you could say, why don't we just let it rip and happen and